Press the bell icon on the YouTube app to never miss a video from Newslaundry.
Welcome to Newslaundry Chhota Hafta. For the full episode, subscribe because it is behind the paywall and only subscribers get access to uncut, complete content. Newslaundry Hafta is our weekly wrap of all that made the news, all that didn't, and all that should have and all that shouldn't have. We agree, we disagree, we critique, and occasionally we beat each other up. But it's all good fun. Subscribe.
This is a Newslaundry podcast and you're listening to NL Hafta.
अंग्रेज अपना लगान और न्यूज़ लॉन्ड्री अपना हफ्ता कभी नहीं छोड़ते. Welcome to the 269th episode of NL Hafta from one of the quietest Delhis I have ever encountered in my life. In rather grim circumstances, we are in office. However, most of the office is working from home. We have a few reporters on the ground only if they must go. We will come on once a week to record a couple of podcasts and our bulletins. But otherwise, we have also reduced much of our work. So some of our other podcasts that you've been hearing, in case the audio quality is slightly compromised, it's because those ones are recorded at home. But this one isn't, and our panel is here in person. Let me introduce you to the in-house panel first. Manisha, hi, how are you doing?
Hi, I'm good.
Mehraj?
Hello, hi.
All well? No sneezing, sniffing, coughs? Raman sir?
Hi.
All good with you?
Yeah, we could all be asymptomatic also.
We could be asymptomatic. And joining us online is Rukmini S. I'll just introduce Rukmini before she decides to tell us what the mysterious S is for. She's a prominent data journalist. She's worked for the Times of India in Mumbai and Delhi. She was the first data editor of an Indian news publication at The Hindu. So you're the pioneer of the whole data revolution, data journalism as a thing. You were the first thing. Huh, Rukmini?
I feel like pioneer is a way to make people sound old, so I'm going to reject that immediately. Pioneer, veteran, all of that, rejected immediately.
Okay. Well, you were the Huffington Post's editor for data and innovation. You work independently. You write for Mint, The Print, Economic Times, and several other publications. You live in Chennai with your husband and 2 children. So, Rukmini, before we get into the headlines most of them are related to Corona, you've recently written a piece. Let me just pull it out here. 30,000, we could possibly be facing 30,000 Corona-related deaths by summer. That's India, not the world. Is that right? Have I got that right?
Right, so I've not predicted it. What I'm saying is that by the current rate of growth of cases and in line with the trajectories of other countries, this could be the direction that we are headed in. There's predictive modeling done by, biostatisticians that shows similar pathways. So yes, without significant intervention, this could be the direction we are headed in. Even with significant intervention, there will be, not an ending but a reduction. And I'm hoping in the next couple of days, similar statisticians are going to be able to come up with some models for what they expect the impact of our current 21-day lockdown is going to be.
Right. So you've written this piece in The Print and it has a really good graph which shows the contrast between Italy and South Korea, where at one point,
Right.
which is the March 4th, South Korea had 5,328 cases, that's 5,328. Italy had just 2,502, and within a week of that, Italy had overtaken South Korea and South Korea's curve had become flat. Now, we'll come back to you and you can just tell us that what exactly did South Korea do specifically that Italy didn't. Before that, I have a couple of headlines that I'd like to go over, and then we'll come back to the discussion. As you can imagine, most of them are based around coronavirus or COVID-19, which is this particular strain of the coronavirus. The India cases have risen to 681 while we're recording this, and the death toll is 13.
Yeah, the latest one was in Kashmir. 65-year-old man in Kashmir.
So the 65-year-old man, that's the first death in Kashmir. There's a total lockdown of 21 days. ICMR has allowed 12 private labs to conduct tests. They have 15,000 collection centers. I believe that in the West, there may be possibilities of actually home kits being delivered. Then Pune-based My Lab becomes the first Indian company to get the test kits validated. And coronavirus shuts down the long-running Shaheen Bagh protest. Also, importantly, the Olympics have been now, it's confirmed that they will be postponed because several countries said that we will not be participating. Madhya Pradesh political developments did not stop. They did not allow Corona to get in the way of either the celebrations or the swearing in or the laddu baantna outside Shivraj Chauhan's, I don't know if it was a house or office.
And I mean, Ramlala idol.
Yes.
placement in.
And the first day of the Navami, Yogi ji placed the Ram Lalla. That also happened. Of course, it didn't happen with as much of a tamasha as the Madhya Pradesh. But I was just wondering how Prime Minister Modi gives that speech one day and the next day this is happening in his state. So, yeah, that's a bit strange. Today we are in the 5th day of the lockdown.
No,
No,
second
no,
day
second
officially.
day.
Officially.
We've been in a bit of a lockdown, but officially it was
Sunday
it's
was the
second day.
Janta curfew.
Yeah.
Right.
So 1 day rest. I think Tuesday Modi announced.
Oh, I see. Okay,
Yeah.
we had gone into work from home
Yeah,
2 weeks
we
ago.
were- we
Okay,
were-
got
That's also because Delhi announced the lockdown earlier. The
I think today is the
restrictions.
second day.
Okay, but yeah, but
Yeah, yesterday was the
we
first
guys have been working from home for a while now.
Yeah.
Okay.
Seems like a very
So-
long time.
Actually, this is another thing that I'd want to, all the people here to weigh in on, that to what extent should journalists actually endanger themselves and expose themselves to the virus? How far is too far? How much public service is too much public service? Then online grocery firms begin making home deliveries to ensure the availability of essential foods. Spain has surpassed China in the coronavirus deaths. And there was panic buying when Prime Minister Modi did that 21-day announcement a few days ago. And Omar Abdullah has been released from detention, and he, I think, tweeted out saying that after getting released by 296 days, I mean, of course, he was being funny, which was nice that he has a sense of humor. That 21-day lockdown after being locked down for 296 days. So let's come back to Rukmini first. But before Rukmini tells us about how Korea managed that, I have an appeal. Do pay to keep news free, because when the public pays, the public is served. When advertisers pay, advertisers are served. If you would have seen the e-papers of many publications, you would have seen that there's just a couple of government ads. And Pepsodent, for some reason, thinks that people want to brush their teeth when they're home a lot. So they had an ad.
They have
But
to.
the
There's no
TV
choice.
channels have got. Their ads have not.
Well, I'm sure they're just exhausting the old, but the private sector will not have money for ads in the next year. The government will have. I hope they spend that money instead of ads. They spend it on social services and the social sector. But pay to keep news free. Go to newslaundry.com. Click on subscribe, because when the public pays, the public is served. And thousands of you contribute to making sure we stay afloat. I hope that support will not wilt during the coronavirus days, because we know we need an active news media more than ever. Rukmini, coming to you now. Tell us what they did right, what they did wrong, and these models that are created, they take into account the age demographic, the healthcare system in the country, etc., right?
Right. So, starting with the South Korean example, it seems that there are two things at least that they did that worked. One was really widespread and aggressive testing, including drive-by testing. You could literally, stall your car by the side of the road, and there were 10-minute tests that they were able to do. So their rate of testing, far surpasses most countries globally. And even in the midst of this crisis, they were able to start exporting testing kits. That's how strong and aggressive their production and their use of testing has been. The second is, of course, it's everybody is saying social distancing to the point that you start wondering if it really even means anything. But it really did. It really was a key part of their strategy, and it really seems like they did it early, did it well, and it did work. I have to say that it's not clear that there is any one thing that one country can do and that will ensure that this doesn't happen. Two countries may do the same thing, but there are still differences. Italy's fatality rates, for example, don't compute necessarily with the state of its healthcare compared to other European countries. So I will say that there's a lot of evolving wisdom around this, and we know some of the things that we definitely should be doing: more testing and social distancing. But I don't think anyone feels very confident of saying that this one thing will do it.
I see. So also, I think what makes a difference is Korea has a smaller and way controlled population than India. And after the kind of images that we saw of the border between Telangana and Telangana and it was the Simandra and Telangana border. It was
The chaos.
Yeah, that chaos.
Yeah.
So when the borders were sealed, and then there was of course chaos at parts of Delhi with people wanting to buy
Railway
stuff.
stations in Mumbai and Pune, all over the country.
So
really.
yeah, I mean, I don't know if those things are factored into models, but I'm guessing. What do you call this? Countries that don't have the discipline that maybe Korea and Japan does. What do you call that factor in modeling? Like the chaos factor or the desi jungli factor? How do you phrase that?
I think what is usually state capacity, but I don't know if there's a word for public capacity. I was reading something by the surgeon Atul Gawande, who was writing in the New Yorker, and he was writing about how in Singapore, doctors even treating coronavirus patients aren't necessarily required to. Sorry, doctors in hospitals aren't necessarily required to wear N95 masks. They've sort of isolated where specific equipment needs to be used, and similarly, even in workplaces, if someone tests positive, they don't just seal off the entire place because they sort of expect that people will be able to understand how much contact they had and then the steps they need to take, and then they'll follow home and self quarantining seriously. So yeah, it is a bit of an immeasurable, right? The ability of the public to respond, and I think when you're not able to measure it, you do the sort of thing that we've done. That I'm not sure we can trust the public with information, so let's do this 21 curfew. I'm not saying I endorse it, but I think this was the thinking behind it.
Okay, so before, I'd like the panel to weigh in on this. Let's start off with the curfew. Raman said, do you think the 21-day lockdown is something that you are okay with or not okay with
See,
as a governance decision?
No, I think all over world, if you see, 42 countries have gone into lockdown, in some way. And I think about 10, 12 countries have gone for impartial lockdown. In US, parts of the countries like New York is complete lockdown. But the other parts are impartial.
Yeah,
so I think
they're having partying on the beach. I really don't understand that country, man.
No, but this when it comes to social distancing in a country like ours, where the 130 lakh crore of people, I think social distancing is important, and I think it has to be imposed. So I agree. I mean that for 21 days, this is for because we don't have. We won't be able to handle so many patients at one go. Right. So I think that is why social distancing.
Mehraj, you are...
If you have to ensure social distancing, in a country like India, there's no other way than to impose a lockdown. But the problem is when you do that, what are the measures in place for the people who are going to be in lockdown? For people who are in decent homes, who have decent incomes, who have decent stocks, they're fine. What about people who don't have all these luxuries, who don't have homes, who are homeless, or who are like migrant workers are stranded all over the country right now? What about people who don't have food to last 2 days? What about people who lived on daily wages? What are the measures in place for them? States have done something, center has done nothing. Modi announced in his speech, he said 15,000 crore for infrastructural health and everything, which is great. But what about the people? Because if you are keeping it for three weeks, after a week when people run out of food, people run out of medicine, they have to go to hospital, what are they supposed to do? They come out, the police will beat them up because they're poor people, nobody cares. And then because if they don't have those options, they'll do something at the community level like people always do. So they'll go in their communities, they'll try to find a way out, and that will only defeat the purpose of the social isolation.
Manisha?
I think if you listen to the WHO press conferences, they've made it very clear that lockdown is one aspect of solving this issue and just one aspect alone. There's a lot of stress on community outreach, and the WHO doctors specifically say that three things you have to ensure. Does your community know what this disease is? Are they aware of it? Are your health workers protected? And do your health workers know how to deal with this? I think simply shutting down is just really, really small thing to do. And I understand that Modi government would have wanted to go under a lockdown because most countries have done it. And I think it's that first initial thing to do. But But he treated this like some sort of I don't understand the need for this surprise element that he wanted to. First he repeated 3 times. रात के 12 बजे सुन लो 12 बजे आज से मतलब इतना suspense क्यों?
Lakshman Rekha.
And then why did you not give? We don't have to stun the virus into anything. It's not Pakistan. I mean, we didn't have to do this surgical strike on the virus. We could have said, look, I'm going to give you 2 days. In this, there's going to be a moderate curfew. But after 2 days, there's going to be a total lockdown. In these 2 days, figure your shit out. Don't panic. If you have to go from one place to the other, please go, whatever. Or basically give people time to prepare. Or even 1 day. I didn't understand this surprise element that he had to throw in. And as a result, and the one basic thing, like when you're announcing a lockdown, the first thing you have to tell people is, because in a sense, nothing really changed.
Everything will be available. Like immediately, in
Yeah.
fact, before his speech had even finished, people were making lines and raiding shops. And
Yeah.
then he had to tweet that relax, everything will be available.
And who are you tweeting to? People are not on Twitter. I mean, you should have said this. People would have tuned into their radios and television channels to watch him. And even I, when I watched it, even I was confused for like 20 minutes. Said, okay, are we going to... Because he specifically says Lakshman Rekha hai.
And
I
also
was-
he
That
said,
means you can't go
isko aap curfew hi samajh lo.
No, I was
It was very vague.
I was waiting for him to
Clarify.
speak about essential services,
He
and
just
it didn't come out.
He didn't speak.
And it doesn't make him hero out of it for the simple reasons that Kerala had done it a day ago. I mean, Kerala is going, different way. They had announced lockdown much before Modi announced it. So Modi, I mean, is trying to, that bravado, sense of bravado is trying to
Yeah, and I
convey.
think that, that was the basic he could have... In a sense, what he just did was simply gave us a deadline that till April 15th, things will be, the way they have been. Because in a sense, nothing really has changed. We were in a lockdown before that also. So he could have at least specified this essential services remain. And then I'm stunned at... I mean, someone who's supposedly was a chaiwallah, grew up in platforms, rose from, nowhere, is so out of touch with how Indians live.
I do think there is a time to say certain things, and this is that time. That Prime Minister Modi and his cabinet have spent the last 5 years trivializing and demonizing civil society and NGOs. NGO wala. Tavleen Singh could not write a column without saying these NGO walas and jhola walas.
Urban Naxals.
NGO was a bad word.
Called them.
And there are enough
they,
tweets about
they
that.
were dubbed as Naxal.
Today you want who to take care of the poor? NGOs and civil society. Because you fucking can't. Now, I know this is going against what I said, but what is a good time to say this? What is a good time? I haven't tweeted this purposely because I don't want unnecessarily to, add to the noise. But what is a good time to say, dear PM, you spent 5 years not just trashing them in the rhetoric, but in law. Record amounts of notices were sent, and this is UP also, to NGOs. The FCRA was cancelled. They were harassed.
Blacklisting.
Like I said, bloody school alumni groups like mine were sent notices, who have nothing to do with any politics. They just bloody host parties and do fuck all. Every single NGO was sent a notice, okay, not every single, but an overwhelming majority who the powers that be didn't like. Now you want them to take care of the poor because you guys can't fucking do that. So anyway, listeners, please write in and tell me when is a good time to say this? Is it 5 months from now, 1 year from now? But when?
These questions should always be asked, because if you don't hammer these points home every single day, this is what happens when the time comes and nobody is bothered.
So I read an interesting article, speaking of ideas, that that'll be my recommendation also. Podcast on the World Bank had come up with what bonds are they called? What are pandemic bonds?
Pandemic.
And when the time came to pay off those pandemic bonds to poor countries, they're saying no, this doesn't qualify for the pandemic that these are bought for. So I think it's really interesting to see how the World Bank is a combination of the worst of the government bureaucracy and of a private limited insurance company that tries to, it brings the worst of both together.
And also this crisis has shown that unless you have your own indigenous manufacturing capacity for all these things, you're screwed. Those ideas which have been peddled for so long that it doesn't matter as long as in some corner of the world there's a factory that supplies stuff,
And
it'll
we
be
had
fine.
Make in India.
Everybody is realizing that's not the case now. China is the manufacturing base of the world, and because they're shut down, the whole world is
The
screwed.
raw material for medicines is not coming
Exactly.
from China.
So there's no capacity.
So we are not
the
a manufacturing country at all.
first thing after this ends, hopefully, start now. First, is the immediate relief. Look after the poor, look after the vulnerable. And once that starts, ramp up manufacturing capacity. India has always, for some reason, prized the service sector more, the IT services and the rest of it. But now it seems that may not have been the
Also, this
way
is
to go.
maybe a good time to do a adding up of all the statues that are being built, the Sardar statue.
The
how
Central
much?
Vista plan,
It's 20,000
which is
crore
again
there.
going... why?
So how
22,000 crore.
how many hospitals and what is the kind of public health safety net could you have created with all this kind of spending?
Whatever we have spent on health sector, since independence days, reflects our infrastructure. Mehraj in his piece, he has mentioned that 1% of the budget is, for the
1% of the GDP,
GDP.
just over a 1% of the GDP. Yeah.
Now see the infrastructure. This is, I'm quoting directly from the government, data. 37,618 total isolation beds available for 130 crore people. 37,618. Total ICU beds, 9,512. I'm giving you all India figure. Okay? And
For how many people? 9,000?
for
For the
130
whole
crore.
population.
Okay.
For 130
9,000
9,512 total ICU beds.
These are obviously the public healthcare
Public health.
hospitals. Yeah.
And then 8,432 numbers of ventilators for 130 crore. So
And
this,
these-
after you see this, then you find why they should go for the total lockdown, because they just can't handle it.
They can't.
They can't handle it. And ICMR study, the latest, they have done one mathematical calculation of the 4 metros, Delhi, Bombay, Chennai, and the Kolkata. So in Delhi, almost the same figure for each metro. So they say that in Delhi, if all precautions that the government is taking lockdown, if it works, so the next 2-year projection is that there will be 2 lakh symptomatic patients
Cases.
in Delhi. 2 lakh. And out of 2 lakh, 80% of them will get cured, and 10,000 of them will be admitted in the hospitals in 2 years' time. And in worst scenario, 95 lakh people will be symptomatic patients, and out of that, 5% of them are going to be in the hospital. And this is true for each metro.
And also, sir,
So
the
then,
I
I
want
mean, I guess we have to turn stadiums into hospitals. What else?
We have already turned schools into hospitals.
From
So there are
Rukmini's-
from different areas, the schools have been chosen for this corona, and already they have been converted into hospitals.
From Rukmini's piece, I'm quoting, she points out that Bihar has 1 government hospital bed for every 1 lakh people, and Goa has 20 hospital beds in comparison. And even if you get ventilators and everything, we have, like, for example, a state like Chhattisgarh has 71% vacancy for specialists at district hospitals. So one more problem is that even if you get the infrastructure we
you don't
need,
have
who's going to
doctors.
operate them?
and there is no time
And
to
you
train
need
people.
specialized people to operate them. And I just, one thing I feel that, I don't know if it's just a question of us being a poor country and not doing enough for maybe people, daily wage laborers or migrants, because on 26 March, Indian government organized, Air India got a private chartered plane to fly back Israeli tourists. They were provided with kosher meals and they were taken back, and there was a special arrangement made for these tourists stuck here. And I mean, this is when the nativist in me takes over. Like the Italian tourists who are here, they were sent to Medanta, the best facility. They've all been treated and cured, and most of them are, they're going to go back home. You would not, Indians don't have that access to facilities that a lot of foreigners have got here. And I'm sure, like, if an Indian was stuck in Italy, I don't think we'd be treated in the way that we have.
Also, when I was coming to office, Naresh, our colleague, he was telling me, he's saying, all these people who are walking home to UP and Bihar, why can't, I understand the trains are shut, the buses are shut, why can't the government say, will get the army or the police or the CRPF, use their vehicles to transport these people? Under quarantine conditions, what is the problem with
chartered
that?
transport, we can do that. They're all empty now. No one's. Or open up the Bihar Bhavan. I'm sure it's empty right now. There's no one there. All these Bihar Bhavan, Andhra Bhavans, all these Bhavans
Exactly.
that are in central Delhi.
All these Bhavans are becoming very fancy places now, and even the food and everything, and you get it, on a premium.
I think
So
it's
if you
not
go to
just,
Gujarat Bhavan now,
I
the
think it's not-
thali
yeah.
costs you 600 rupees.
I think it's not just about us being poor. I do think we don't value our own people and our own lives. I don't know if in South America, for example, I think there are other nations who kind of value themselves more than we do. I do think that Indians don't value.
India's spending
them.
on people is abysmal. So that is also part of it. The poverty is also part of it. But when you see the same kind of facilities, so the numbers you quoted, the bulk of them will be in metros, in cities. Imagine you are in
the villages, you have nothing.
Exactly. Imagine you are in a village in Bihar or UP or somewhere else, and you get sick. The nearest ICU bed will be, I think, 300 kilometers. So how are you going to get that, especially in a lockdown?
In Delhi, the public health facility, we have done a story in Patriot. You have, for the entire population of Delhi, you have just 252 odd ICU beds. That's it.
This email is from a former subscriber. We don't usually take former subscriber emails. We take active subscriber emails. But I've made an exception because I guess at some level he has a good reason for not subscribing anymore. Although I'm not quite convinced, but nevertheless. Dear Newslaundry, I was a subscriber, but I no longer live in India, so I've taken to supporting independent journalism where I live. This will be a brief email. I keep hearing Abhinandan and other panelists saying this is chilling, or this is disturbing, or this is dismaying. Repeatedly. What changes after these statements? I've been hearing this for decades now, and I can't see the light at the end of the tunnel. Modi's speech told me one thing, in chilling clarity. Indians are on their own. The government may as well not exist for the vast majority of Indians. Every action of the government is ham-fisted and displays utter incompetence. They can conjure up the cash for a needless statue but can't provide libraries, decent schools, or proper sanitation. All things that will pay rich dividends in the future. How do you have faith in the future of India? As for the near future, I expect to see disaster in India with thousands dead because of the government's incompetence and stupidity and the stubbornness of citizens. Regards, a former subscriber. Okay, on that rather dismal note, I think change happens. It may not happen as fast. It has happened in my lifetime. I mean, just our expectations from democracy. I see the difference between my grandmother and me, my mother and me, my father and me. So things change. Your expectations from democracy changes. Even the fact that you were asking these questions, which earlier generations didn't ask, that is a change. Impatience is a change. So I'm a little more optimistic. But yeah, it can be exasperating and painfully slow. Anyone else has anything to weigh in on that? You see the light at the end of the tunnel or don't?
I
Mehraj?
think my whole article this is basically a summation of my whole article yesterday. So I have nothing
I
left
तो
to
these
say.
days suffer from like irrational hope. Like part of me thinks कि India में नहीं होगा और weather will save us or बस it'll just Corona will just go. And then part of me is just bleak. I think we're going to be in a police state and all of us will be dead in like tents and there'll be water
You have a
riots.
theory that Modi will use this to come down like
Well,
nothing else.
there's a lot of pieces that have been done on this. And there's one in The Atlantic recently that talked about how the world over, pandemics are great. A pandemic and a paranoia is a great time for people with authoritarian or dictatorial tendencies to make use of and then
Manoj Joseph बोला था. Manu Joseph wrote something around this.
No.
No.
Manu Joseph to advocated. He said that this is a good time to,
That's
take
what I'm saying.
stringent.
That this is a good time to take away civil liberties.
But like for example in Israel, Netanyahu, there was supposed to be an inquiry on him, and he just disbanded that inquiry.
That is almost a coup.
Yeah,
what he did.
Who did?
Netanyahu in Israel. So
Right.
I do think like a fear of a paranoia and fear like this you can use it in a prolonged way to then constantly control your citizens with
So our wonderful producer Aditya just pointed out an article about an app that the government plans to use to track the virus. So while it's tracking the virus, it can track a lot of other things.
Track the virus? How exactly?
So I guess it's contact tracing. Now, if I met you, then before that. So if that app is there, it knows which are the two SIM cards that are in close contact.
No, but the problem in India is people who are in contact or who came from outside, they're hiding. They're not revealing their histories.
Yeah, but that if they can track your SIM card, then they know where you are hiding, who you met, who you touched.
In Punjab, my friend who's part of the health secretary is leading the team and he's an IS officer, he's part of it. So he told me 40,000 Punjabis had come in the past 15 days. He told me about 5 days ago. 5-6 days ago. 40,000 of them. And they are hunting for those 40,000 Punjabis who had come from, abroad. Overseas.
In fact, there were videos.
And in Punjab, because I have gone there quite often, so I have seen this tendency. People hide their diseases. If you are suffering from diabetes, they don't want to announce it to the world. I mean, small things they hide everything.
Achha.
Haan.
I guess, but what you're saying, it led to violence actually because the cops went to get these people out because they have to be quarantined and the women of the house are coming and jumping up the cops and सरकार तो जितनी बुरी है हमारी जनता भी मतलब
वही
but I don't blame the Janata. I mean, I do think that if I had only access to the media that we do today, like the Hindi news channels and WhatsApp and Facebook, and I had very little, in terms of investments, in terms of education or public service announcements from the government, I would also be as paranoid as irrational as a lot of our citizens are. There's just simply, and this is why I would recommend right away that there are 2 press conferences by the WHO doctors where they repeatedly say that you have to, this cannot be fought without bringing communities on board. You have to educate the community, you have to bring them on board, you have to explain to them. I'm sure a lot of people still don't know what coronavirus is, and it's not their fault. Media has not done a good job of explaining to us what it is. Government has not issued enough public service announcements. In fact, I think again, to go back to the government's elitism, you have Anurag Thakur put up a video of Saurav Ganguly speaking in English. You must wash your hands, you must do this. And he's like, must watch video. I was like, you're putting this on Twitter, but I know this. A lot of people on Twitter know this. Why don't you put it on DD and AIR in Bengali?
And immediately followed by, Haath ke gaddaron ko dho dalo salon ko. Because that you are known for that kind of slogan.
But
the people listen also.
Have we done enough to educate people on what this disease is?
Not at all. If the people who you're bringing on TV to educate is Sadhguru and Ramdev, I mean...
Tariq says, hi, I hope my letter finds everyone well, safe and sound. I can't thank enough of the crew of Newslaundry who are out there fighting on every front to bring the news we don't deserve and ensuring the insane country there has some sane news. I write this letter with a lot of anger and sadness, and I said to myself that Abhinandan is the perfect person to understand. Okay, is it because I'm always angry or because I'm always sad?
I suppose angry is...
Angry.
Okay. In the aftermath of COVID-19 outbreak, the thing that made the most sense is how underwhelmingly and hopelessly unprepared we are to cope with anything out of our comfort zone. And I'm not even counting the government in this discussion. I always knew Modi and his entire cabinet don't have an ounce of knowledge to understand the gravitas of social welfare and public infrastructure. So with an outbreak, I wasn't surprised with lackluster preparation. Particularly on airline services, and the uncertainty of upcoming air travel is something I faced recently. As I was looking to reschedule my ticket booking on Air India, I found the entire setup a farce and harassment to the general public. Since this was an unprecedented situation, MMT was not taking any responsibility for cancelling the tickets, and Air India removed its provision to cancel or reschedule flights. For any kind of ticket change, one had to call customer care, which needed 15 dials to get connected, with an additional 1 hour of the waiting period. Clubbed with multiple calls and coordination with MMT to get your money refunded, I ended up spending 8 hours on phone calls. The icing on the cake was mismanagement. For every call I made, the executive gave me a different amount as part of cancellation. There could have been so many ways to ease customer pain. Call center executives certain tweaks as in web application, and yet from Air India to MMT, all of them just did not have in them to fix an issue when the shit hit the fan. As all this was happening, I watched Civil Aviation Minister gloat over supporting the harsh punishment of one of the customers. Yes, during this, Hardeep Puri in Parliament said that I'm glad that Kunal Kamra. Yeah. I'm really shocked at him, dude. Let it go, man. I mean, punishment to talk about in Parliament. Anyway, so, and later didn't meet the eyes of the government slapdog. I pity myself that despite 44 European, 2 North American, 2 oceanic countries, I was cursed to be born here.
Oh, God.
Oh, my God. Okay.
Wow.
He's really angry. A long time back, Abhinandan raised a very potent point that us Indians are, and he's used an expletive, pardon my language, and there is very little morality and ethics left in us. No matter how technologically advanced we are, our basic instinct to screw people over a drop of a hat won't go. We will forever be struggling to be a well-governed country, as we, as Indians, offer very little to the society and others while we expect too much in return. I have enclosed a certain picture which someone forwarded me. And it's a picture of that 2000, that Joker saying, when pandemonium breaks out, when he says, you guys kill them or you guys kill them. And Joker says, I quote, see their morals, their code is a bad joke, dropped at the first sign of trouble. They're only as good as the world allows them to be. I'll show you when the chips are down, these civilized people, they'll eat each other. See, I'm not a monster. I'm just ahead of the curve. So, yeah, which is why I think The Dark Knight was one of the best films I've ever seen, because not just superhero action element, it had a message that was, it was viable. It was, comprehensible and possible. So, yeah.
Yeah, and these 2 movies, Dark Knight and Interstellar, I thought they were like very intellectually very sound and
Yes.
very philosophical in that way.
Interstellar, तो I couldn't understand only क्या हुआ.
I mean, it wasn't so. I thought it wasn't so much about the
Like,
science and the rest of it.
It was too intellectual and I couldn't get it.
No, I thought it wasn't so much about the
Yeah, but it was
science of it and the rest of it, but the whole morality of what it means to be human.
Exactly.
And
I thought it's one of my favorite films, Interstellar, man. I loved it.
And that guy, wow.
Yeah.
Matthew McConaughey.
In fact, that scene when he's watching the messages from his daughter, and she has messaged, and she says, "You left here," because time is passing much slower for him than it is for her. So she's an adult by now, and he's probably been just gone a few weeks or whatever it is. And she says that you had said that I'm as old as you were when you left. So this would be a damn good time to get back. And that's such a moving scene. It was beautiful. And this mail is from Manjari. Manjari says, "Hi Newslaundry team. Thank you all for your hard work getting us accurate information that we can trust. I'm a subscriber living in the Seattle area, which was the first epicenter of the coronavirus in the US. Hey Manjari, I hope you're well. Yeah, I read all about Seattle, man. Be well, be safe." Then Manjari goes on to say, "Over the past week, I have been increasingly worried about the situation in India. It seemed from news reports back then that India was protecting itself well, and there were no cases of community transmission. Turns out that was because they weren't testing for it. Why? Because they hadn't detected any cases. Great logic. There is a huge data gap. The news articles are full of useless government oratory and barely have any numbers. The government does not give daily counts. India needs a website tracking the total numbers of positives plus number of negatives with a state-wise breakup like this, and which picks up data from here." So she's given the doh.wa.gov/emergency/coronavirus and the covidtracking.com/data. So I see journalists tweeting some numbers. I'm in 4 weeks of self-isolation and sense of community is more important than ever. The podcasts help, and if you can do more discussions with subscribers, it may be interesting too.
Oh yeah, we should call all subscribers
So
from different
Manjari-
parts of the world who are self-isolating. And
So Manjari, in fact, just before we started recording this, I had a chat with Snigdha and Meghnad and Chitranshu. We are going to be doing a series of podcasts. We're going to start now. The audio quality will not be great because they'll all be recording online. But with subscribers debating various issues, subscribers talking about their area of expertise. And we're also starting a new podcast, NL versus NL. That should be rolled out either next week or the week after that. I think, just having voices that agree with you, disagree with you, but at all times make the environment seem lively, I think is important. So we'll be doing a whole bunch of that. In fact, we're going to be starting a travel podcast. Yes, that's right. I repeat, a travel podcast at times like this. With Rocky, Mayur and me, it'll be called Highway on My Podcast. So yeah, that's coming up soon as well.
Very unoriginal.
All of you listening in, the Chhota Hafta, do subscribe so you can listen to the entire Hafta. We will see you again next week with the Hafta. Till then, subscribe, pay to keep news free, because when the public pays, the public is served. When advertisers pay, advertisers are served. Thank you. Goodbye.
All the Newslaundry podcasts are available on Stitcher, iTunes, and any other podcast platform.
Please subscribe to Newslaundry. Help us keep news independent. To catch all our podcasts on news, pop culture, current affairs and sport, visit newslaundry.com. Follow us on Facebook, Twitter and Instagram, and subscribe to our YouTube channel. Sun liya Afrika, mufat khoro. Not to brag or anything, but Newslaundry Hafta features in the top 50 in the world on SoundCloud in the news and politics category for podcasts. So do subscribe and see what you're missing, because when the public pays, the public is served. When advertisers pay, advertisers are served. Subscribe, help keep news independent and free. All Newslaundry podcasts are available on iTunes and Stitcher and any other podcast platform.